viewers, you are welcome to Limi Hospital Antenatal Lecture. My name is Nurse Marian Okoroma, the Nurse Manager, Limi Multispecialty Hospital. Today, we are going to discuss on the topic, dangerous signs of pregnancy. Pregnancy itself is a risk, so it has so many dangerous signs. And why this topic is very, very important is because some of us, when we are pregnant and we are having some problems, feelings, we are not comfortable, we start seeking for advice here and there. And that is why this topic is very, very important for you to know when you feel these signs, what to do and where to go. Important symptoms that may arise in pregnancy that must be reported to doctor or midwife. Pregnancy is a wonderful and a happy time in any woman's life. And to ensure your pregnancy is without any problem, there are certain things you have to look out for. One of them is vaginal bleeding. In any pregnancy, spotting can indicate either implantation bleeding, but any bleeding in pregnancy should be investigated. When you notice bleeding in pregnancy, don't take it for granted. It must be reported. The first trimester bleeding may indicate an ectopic pregnancy or miscarriage. So the first trimester is the first 3 months of pregnancy. So bleeding at that time could mean miscarriage. It could mean there is ectopic pregnancy. Ectopic pregnancy means when the fetus, when the fertilized egg was implanted or was embedded outside the uterus, either in the tubes. That's ectopic pregnancy. In later pregnancy, vaginal bleeding could indicate placenta previa, which means placenta is embedded before the baby, or abruptio placenta, which means placenta is being separated, or placenta is separating before the time. That's abruptio placenta. Then infection can equally cause bleeding. If you notice any bleeding, then you should be examined by your doctor. This is not the time you stay at home and start getting advice, oh, that is how it happens, that is what happens. Any slightest bleeding you notice when you know you are pregnant, you report to the doctor immediately. This is a picture of a pregnant woman bleeding. You can see the pads soaked and all that. So it's very, very important. When you notice something like this, you notice blood in your pants, go to your doctor immediately. Another dangerous sign in pregnancy is headaches and blurred vision. This can indicate preeclampsia, which is diagnosed usually after 20 weeks of pregnancy. Your doctor will look out for high blood pressure, protein in urine, indicating kidney involvement. When there is protein in urine, which means the kidney is involved, there's problem with kidney. Okay, so when these two signs are seen, or vital signs are recorded on your visit to doctor's office, the BP is high, there's protein in urine, then there is problem. If left untreated, preeclampsia can lead to a serious pregnancy complication called eclampsia. So pre, because it's now before delivery, within the time you're pregnant. If you notice BP is high, then there is protein in your urine. It's a very dangerous sign that need to be followed up. Eclampsia is now a situation whereby now there's convulsion, as layman may call it, convulsion or seizure. And is a very, very dangerous sign in pregnancy. If left untreated, preeclampsia can lead to a serious pregnancy complication called eclampsia, which presents with very elevated blood pressure and seizures. This is very dangerous for mother and baby. In some cases, it is a very serious emergency in the life of a pregnant woman, and if care is not taken, in some cases you might lose both the mother and the child. And that is why it's very, very important you monitor yourself. You don't take any sign you notice around you for granted. Report every headache. Report when you are having blood vision, you cannot see where you wake up and you're feeling dizzy and all that. This swelling of different parts of the body that is associated with preeclampsia, because there are so many signs you might see. I have headache, serious throbbing headache, blood vision, swelling of the legs or hands, at times generalized edema, that's swelling all over.